This film is part of a continuing series of education in orthodontics and dentofacial orthopedics by Dr. William Clark. Functional therapy aims to influence facial growth and to improve facial appearance. We are concerned with faces and braces. Twinblocks represent a breakthrough in functional therapy using simple, comfortable appliances to achieve consistent improvements in facial appearance in a wide range of patients extending from childhood into adulthood. Twinblocks were developed here in orthodontic practice in Scotland in 1977 and are now used throughout the world to achieve rapid improvement in facial appearance for patients who have an incorrect jaw relationship. The Twinblock is a very simple appliance which works on the inclined plane principle and causes the lower jaw to bite in the correct position. It is the constant force of biting forward which corrects the jaw position and rapidly improves the facial appearance. This improvement is immediately evident on the day the appliance is fitted. This shows the dramatic improvement in profile the day the Twinblock is fitted as the patient bites in a forward position. The long-term effect of this is to correct the jaw relationship by encouraging the lower jaw to grow forward, as we see here after 11 months treatment, and in the profile 2 years later. The corresponding correction in the bite is shown in this comparison of the teeth before treatment and after 11 months treatment. There have been many other functional appliances which have been used since the beginning of this century, but they have all suffered from the same disadvantage of being made in one piece to fit the teeth in both jaws. These appliances were bulky and cumbersome and difficult to wear without causing embarrassment to the patient. They restricted the tongue and noticeably interfered with speech, causing a pronounced lisp and other distorted sounds. Compare this patient who has just had a Twinblock appliance fitted and is quite comfortable. By comparison with all the one-piece functional appliances, the Twinblock is the most patient-friendly of all the functional appliances. The patient is spared the embarrassment and can eat, speak, and function normally with Twinblocks in the mouth. Another advantage is that the Twinblock can now be designed with less visible anterior wires without losing efficiency in correcting the jaw relationship. That is why the Twinblock is now recognized as the most aesthetic and the most comfortable of all the functional appliances. The Twinblock does not interfere with normal function, and we can see the simple action of the appliance as the patient bites forward. The patient very quickly learns to speak normally with the Twinblock appliance. Let us look now at another patient who presented a severe problem which is evident in profile. After 11 months treatment with Twinblocks, we see a remarkable facial change. The facial appearance is dull and listless before treatment, which is common when the lower jaw is receding. In this condition, the airway is often restricted by a backward tongue position. After 5 months treatment with Twinblocks, we see a noticeable improvement in appearance and alertness. Even the skin condition can improve in Twinblock treatment, and some investigations suggest that an improved airway resulting from functional treatment has beneficial effects on the patient's general health. This is the anterior view after 11 months. The improvement in appearance has a very beneficial effect on a patient's confidence and self-esteem. In this severe malocclusion, Twinblocks have achieved a non-surgical facelift. The dental changes in this case are equally dramatic compared to the facial change. The The upper anterior teeth are excessively prominent before treatment. They are literally hanging out to dry outside the lips. The correction was achieved in this case by correcting the jaw relationship, by advancing the lower jaw with Twinblocks. We now see a succession of patients treated by the Twinblock technique, showing the improvements in facial appearance which can be produced by this approach to treatment. You can appreciate from these results that we are not only concerned about correcting irregular teeth, we are concerned also to improve the face. Twinblocks are of tremendous benefit to facial appearance. Before treatment, we assess whether we can improve the face by correcting the jaw relationship. A careful diagnosis is necessary to choose the correct treatment for each patient. If the problem is defined as an incorrect jaw relationship, we choose an orthopedic approach to treatment, and by correcting the jaw position with Twinblocks, we can dramatically improve facial appearance, and these changes are of permanent benefit. The same principles can be applied to treatment of the lower jaw, especially in the young patient. We see now a rapid improvement in the profile after 8 months treatment. This approach has the great advantage of avoiding surgical treatment, which is often necessary at a later stage of development to resolve this problem. We now look at the application of the Twinblock technique in adult treatment. We look now at a 45-year-old female with prominent upper incisors which rest outside the lower lip. After 2 years treatment, the profile is considerably improved. Treatment tends to take longer in adults than in children. This shows the prominence of the upper teeth and the appearance of the teeth before treatment, compared to the improved position after treatment, which in this case resulted from a combination of Twinblocks with a fixed appliance. The end result is a happy patient and a confident smile. It is true to say that functional appliances create aesthetic faces, and we use functional appliances to improve facial appearance. Let us now look at a brother and sister treated with Twinblocks to achieve a non-surgical facelift. Fraser was 9 years 5 months when he started treatment, and his teeth are hanging out to dry. After treatment with Twinblocks, he is able to close his lips comfortably and has noticeably matured in appearance. In profile, the chin is severely receding, giving a weak appearance to the face, which is improved considerably after treatment. These features are evident when we examine the teeth, which are prominent before treatment and are corrected after a year. We then observe the long-term improvement 6 years later at age 17. Now, Fraser can smile with confidence. Fraser's sister, Charlotte, presented a similar problem at age 11, and again we can see that the lips do not cover the teeth, and the chin is receding. Charlotte had treatment by Twinblocks, which significantly improved the face, and she can now close her lips together comfortably and has a pleasing profile after treatment. A second stage of treatment with a fixed appliance achieved detailed correction of the teeth and a beautiful smile. The long-term benefits of treatment are evident as we follow Fraser and Charlotte through and see them mature. A confident smile is a great asset both at work and play. At work, for example, a winning smile can result in a successful interview for a new job. Unlike many other forms of cosmetic treatment, a beautiful smile and a well-balanced face are permanent assets which remain with you for the rest of your life.